Hello, everyone, and thanks for joining us today. My name is Mary Martin. I'm the Vice President of Strategic Alliances at Surescripts. We're glad you took the time to join this webinar about our National Record Locator Service. This session will allow you to learn how you can enhance interoperability within your EHR. After our presentation, we'll have plenty of time to answer any of your questions. So at any time during the webcast, just enter your question in the Q&A box on your screen. We'll try to answer as many of your inquiries as we can. Please note that all of the windows in your console can be sized to be larger or smaller as you desire. Just put your cursor on the bottom right corner of the window and click and pull to resize. If at any time you do need help, simply click on the Help button located at the bottom of the screen, and someone will reply to your concern as soon as possible. I'll start the presentation by giving you a quick background on Surescripts. I'm going to introduce our speakers, and then I'm going to hand it over to Dean Rutherford, Director of Solutions Engineering at Surescripts. All right, we've got a lot to cover, so let's get started. So over 10 years ago, Surescripts built a nationwide network to connect doctors, hospitals, pharmacies, and health plans to enable the secure and efficient exchange of prescription information. Since then, that network has expanded to provide additional solutions, including the e-prescribing of controlled substances, medication history for reconciliation and population health, electronic prior authorization, among others. And today, we're going to talk about expanding provider connectivity and delivering the future of data exchange to providers today. As healthcare industry demands grow, care coordination and visibility into patients' health histories are becoming vital to your customers. With Surescripts National Record Locator Service, or NRLS, you can give providers access to their patients' complete health histories within your own application, regardless of where care was received in the past. And today, you're going to learn how NRLS can help you remain competitive and connected. I'd like to introduce our speakers. Dean Rutherford, he is the Director of Solutions Engineering at Surescripts. As a leader of the Solutions Engineering team, Dean focuses on customer product education. Since joining Surescripts in 2006, Dean has held leadership roles on several teams, including integration and certification and clinical interoperability operations. He has more than 25 years' experience in the healthcare industry, spanning retail and mail service pharmacy operations, prescription benefit management, electronic prescribing, and clinical messaging application, and standards creation and maintenance. That's a mouthful, Dean. I'd also like to introduce and welcome Mohammed Chabli. He is our Senior Product Manager of Interoperability for NextGen Healthcare. He's a healthcare IT professional with 15-plus years of experience managing enterprise application design, development, and implementation. He is primarily responsible for the NextGen Share platform, which connects NextGen EHR customers to external providers, organizations, payers, and registries. Welcome, Dean and Mo, and now I'll turn it over to Dean.
Thank you, Mary. Give a little bit of framing for the conversation today. Have a statement here from class defining some of the goals of interoperability. So what we're striving to achieve as an industry is helping assure that records are, 1, available, 2, easy to locate, 3, can be presented within a clinical workflow, and ultimately are delivered in an effective way that helps improve patient care. So that's being positioned as an interoperability home run, if you will. So that'll be the underpinning of a lot of the conversation that we intend to have today. Now, while we clearly understand what the objectives are for interoperability, we find that there's a lot of improvement that we can make as an industry at this point. There is certainly some availability of information in the industry. There is certainly an understanding that there is some availability, some access to that information, and even some instance of being able to present data within a clinical view. But when polling providers, only 6% of the time are they indicating that the solutions they have available to them are helping them achieve this interoperability home run. So we're going to speak a little bit today about how Surescripts National Record Locator Service can help in this strategy, ultimately create a broader set of visibility for care providers and the patients they're caring for. The National Record Locator Service is designed to help give you that more complete view of patients' histories. For the first time, Surescripts is going to start to leverage the massive amounts of data that flow across the Surescripts network. Think of it as a network-level service. The objective of nearly all network-level services is that there's a critical mass of participants openly exchanging data. The unfortunate truth of most network-level services as they go live is that the first organizations to take advantage of that solution have very little in the way of an inherent value. The key difference for the Surescripts National Record Locator Service is that it's layered on top of an infrastructure that has visibility to millions of patient records, billions of patient encounter events, so there is an inherent value to the network from day one. Conceptually, what's going on with the National Record Locator Service is it's expanding upon connectivity and relationships that you may already have today. So you may have an ability within the EHR, within the system of record that you utilize, to exchange information with providers that are using the same system. You may have connectivity to local or regional health exchanges. What the National Record Locator Service will contribute to the existing connections you have is revealing to you where else has a patient been seen. Outside of my own enterprise, outside of the visibility that I have with my own system of record, the solution can reveal to you the names of organizations, the names of providers, the specialties of those providers, and dates of service where we know that another provision of care has occurred for that patient. So we're revealing to you where other care events have taken place, where other patient-provider relationships exist. What you will get back through the service, a set of kind of 3 layers of this service. Initially, and part of the day one value in the service is that provision of where has my patient been seen. We can return to you a CDA formatted document that will list for you who has seen my patient and on what date. So the name of the organization, the name of the provider, the specialty of that provider, and then some basic contact and demographic information as well. What will accompany that information are the technical electronic coordinates of where clinical documentation resides for that patient. So this allows you to take advantage of point-to-point, peer-to-peer connections that you may already have established, allows your system to recognize those coordinates, and then has an ability to query for content rather than forcing a user to manually sort through a phone book of possible listings and select where they want to query information. Additionally, the network itself can serve as that aggregated connection point, and you can use the Surescripts network as that retrieval mechanism. So it's complementary to connections you have today. You wouldn't be forced to forego those connections, but it affords you the opportunity that if you wanted to consolidate some of the connections you manage today, the network, the National Record Locator Service, certainly affords you that opportunity as well. The benefit of using a network-level service like National Record Locator Service deployed across the Surescripts network is that the service now becomes that aggregated connection point. So to restate that, you can use the Surescripts connection as a way to reach multiple defined endpoints. You can trust that the data is going to be reliable. It's going to be formatted in a consistent way, allowing your systems to be more efficient in the way it queries for information, receives information, and ultimately presents that to your users. If we think about this in a process flow, if I go left to right from the diagram you're looking at here, think of it as a patient presenting within a clinic, within a hospital where you have system users. Your initial request into the Surescripts network, into the service, is going to uniquely identify the patient, and return to you that location summary that indicates who else has seen my patient, what are the dates of service, what are the specialties in which that patient has been seen. I can use that information to have a dialogue with my patient and determine which of those previous encounters are relevant to the care I am about to provide this patient. And then the service is designed, again, to be additive to things you are doing, so you can use the Surescripts network to retrieve clinical documents. You could also use your existing peer-to-peer connections if you so chose. And if there is an instance where the network is not electronically connected to an endpoint and you do not have your own electronic connection to an endpoint, within that care summary that we return to you is the basic contact and demographic information for that organization, for that provider. So there's a means by which you can reach out to them in a more manual sense if that need arises. The solution, National Record Locator Service, affords you an opportunity to stay competitive and connected in an environment where there's an increasing number of consolidation efforts within the industry. One of the primary reasons for that is that an existing system of record, when a new health system or a new hospital system comes into a region, one of the reasons they tend to replace systems is that there's a lack of true interoperability. I don't know how to get records that exist in that incumbent system. What patient records do they have? How do I get those patient records out of that system? Utilizing a National Record Locator Service now affords you the opportunity to have a more readily available means of exchange with another disparate system. You can retain your users because they will have the ability to both be visible to that other system and query information from that external system as well and pull it back into the system of record they're currently using. We're utilizing the Carequality definition of the IHE transaction sets. Surescripts becomes the implementer here, using the Carequality framework, the definitions for rules of engagement, the trust connections, the definition of that transaction down to a common level. So your connection to Surescript gives you a technical ability to query all endpoints that are also using those Carequality frameworks, but doesn't require you to establish multiple endpoint, peer-to-peer, point-to-point connections. You can utilize that aggregated connectivity to Surescripts to reach all of those endpoints. The solution does also help position you for current and future regulatory requirements, some specific guidelines within the MU3 and within MACRA. This solution can help position you to meet those criteria as well. And this is an innovative way to start to utilize information across the Surescripts network in a new way, and it sets a nice foundation for future capabilities that are inevitable through this type of exchange connectivity solution. If we take a look at where we are with the adoption of the service to date, we are still early in the life cycle of this solution, but we've seen some tremendous usage already. So just since March of 2016, we've received 5 million patient discovery requests into the network, and that's across a small number of early adopters, but with transactions across all 50 states. That has produced a return to those early adopters about 1 million location summary documents, so that listing of where has a patient been seen, what was the date of service, who were they seen by. Contained within those location summaries is somewhere on the scale of 21 million external patient visits that were identified. Nearly 10% of the patients identified there had more than 50 external visits over a 3-year period. So that's a breadth of information you previously would not have had visibility to, or you might have been dependent upon a patient or a patient's loved one to reveal that content to you, now being returned to you in a more automated fashion and incorporated into your existing workflows. Across that volume of data that has been returned, we've identified 147,000 unique providers seeing patients that are being cared for through this type of solution. Now I'm going to turn things over to Mo Chebley to speak about NextGen's plans relative to interoperability and how they intend to incorporate the Surescripts National Record Locator Service as part of that strategy. Mo?
Great. Thank you. Welcome, everybody, and thanks for joining us on this webinar. I want to speak a little bit about NextGen and our plans for NRLS. But before I jump into what we've already done with NRLS, I want to tell you a little bit about NextGen and our ambulatory EHR. Our company has been around for more than 25 years, helping customers in the ambulatory space really support patient care and empowering physicians through data sharing. And one of our key metrics is really focusing on that ambulatory space, private practices that are operating in a community with a vast array of patients, probably multiple locations to that practice, and they have very specific needs when it comes to data sharing. Our solution set helps support that, and really our goal with NRLS is to extend that functionality, and we've already done that and seen some good results, which we're going to talk about today. The NextGen client base is really filled with a variety of different types of clients. Clients that today participate in ACOs. More than 30% of ACOs have NextGen clients within them. More than 40% of PCMH clinics are NextGen ambulatory customers. And that really speaks to kind of our focus on that ambulatory space. And one of the things that I want to focus on today is how NRLS can help connect ambulatory practices to hospitals, to other ambulatory clinics, and really to an entire community. Our clients using our software have earned more than $1 billion in those MU incentives, and also for FQHC clients, FQHC practices, about 33% of all FQHCs use NextGen ambulatory solutions. So I just want to give that perspective that we know the ambulatory space, and we see NRLS as really a key driver, a change agent to help improve the functionality of those ambulatory clinics. The NextGen EHR is really a fully integrated solution. It has tools for interoperability, for RCM and billing, pop health, patient portal and analytics, and many other solutions. NRLS is really an extension, from our perspective, of our interoperability suite. And the connectivity that it allows, as Dean explained, the ability to locate patients' records from a variety of clinics, is an extension of something that already exists in the NextGen user world, which is something we call NextGen Share as part of our interoperability suite. I think, though, that one of the key things to remember about NRLS is that it's really a tool to help you identify where patients have been seen previously. And that's part of a bigger population health strategy, the ability to get data and then act on it because it's actionable data, it's structured, it's a CDA document with location history, and then the ability to actually go out to those edge systems and retrieve the structured clinical content is really a key differentiator when it comes to managing an entire population of patients. When you have access to that information natively in your EHR, it empowers the physicians to make decisions based on that data. And this is something that Dean spoke to as part of the class most recent interoperability report. The ability to locate and act on that data is what drives that entire interoperability home run. I'm going to speak in a moment about how we've used NRLS at NextGen, but I want to remind folks that we're really focused on ambulatory and private practices. And I think this is where NRLS will have the greatest impact on a physician's day-to-day experience and, of course, on patient care. Our customers in that small practice ambulatory space have very specific needs when it comes to connecting to hospitals and connecting to other clinics. For example, patients who are treated at a hospital or discharged from a hospital, or patients who are admitted to a hospital, if that hospital system is participating in NRLS, our customers will have the ability to get that information out of that hospital system quickly and easily, and with very minimal effort on their part. So the small practice and ambulatory experience, I think, is going to be the key differentiator for NRLS end users. NextGen interoperability has taken many different forms, and really this is not just unique to NextGen, but interoperability as a space over the course of many years has been changing. It started with simple point-to-point interfaces for orders and results with radiology and labs, of course medical device integration, but over the course of time it's grown to include things like direct messaging and HIE connectivity and provider-to-provider messaging. NRLS is another tool that's going to improve the functionality of connecting to external physicians. And this, when you ask physicians, when class asked physicians in their most recent survey, what is the barrier to successful data sharing? The number one answer had been and was, and this is a 2016 report recently issued, that there's really a lack of a national infrastructure. So most providers, when asked, why aren't you sharing data today, they point to a lack of a national infrastructure. And tied with that is technology complications and drawbacks to that technology. Well, one thing that we're really excited to be as an early adopter, an early participant in NRLS, is that we actually now have national interoperability infrastructure that's built on standards. And there are a lot of examples of these. Carequality, which Dean mentioned earlier, is a national interoperability platform for secure data sharing, for the ability to identify where patients have been treated, for querying and retrieving data from participants. And it's built on published standards that have been widely adopted. There are other examples, including Direct Trust, that have provided that same type of national infrastructure. But there are other things that you can glean by looking at this class report. And one of them you can see kind of in the middle is your competitor's lack of resources or expertise, but also your competitor's unwillingness to share at 26%. If you look further down, at 6% comes in your organization's unwillingness to share. So most providers, when asked about data sharing, they point to the national infrastructure, which we now have a solution for. But most people also think that their competitors are less willing to share than they are. So from one perspective, you can say, there's a belief that everyone else is getting in the way. But now I think when you marry a national infrastructure, as Dean described, the ability to locate and retrieve patient records, and if we go into that with the perception that, we're all doing it for the right reasons, we're all willing to share, I think a lot of great results will come out of that. And one thing that I want to talk about briefly is what type of data sharing do we as vendors, from an ambulatory perspective, what type of data sharing do we have to support today? And then what does NRLS do to improve that? So I want to paint a little bit of a picture here with the type of exchange that an ambulatory EHR like NextGen has to support in the wild today for our customers. A common request that we hear all the time and that we support very broadly across the country today is data sharing with an HIE or data sharing with a hospital. And a lot of them have similarities, so you'll forgive me for maybe oversimplifying some of this. But one of the most common requirements for an ambulatory EHR is the ability to respond to requests from hospital systems. And those typically come in the form of patient discovery, where a hospital that a customer connects to needs to be able to identify from its ambulatory community, do you have records for a given patient? So those requests come in the form of patient identifiers, demographics, enough information for our EHR, the blue side, to say, yes, we have a record for that patient, John Smith. The ability to perform this type of action in the community today is an absolute requirement. But one thing that this graphic doesn't really represent is the need for that hospital system to make this same request of multiple practices in the community. Also, the ability for that ambulatory practice to respond to multiple requests from a variety of hospital systems. But once you've made that request, do you have a record? You also need to be able to respond with documents. can I have that record for John Smith? The ambulatory EHR has to be able to not only say, yes, here is the record, but then also generate the CCDA and provide it back to the hospital. So document retrieval and document response is a key requirement. So when I put on my NextGen ambulatory product management hat, one of the things that I have to look at, not just one practice or one provider at a time, I have to look at our entire user base. And we have to provide tools and services that connect to that entire user base to not just one hospital or one other EHR vendor, but dozens of EHR vendors, dozens of hospital vendors across the country. And if you think of NextGen as a monolithic vendor, there are many other hospital systems that we need to connect to that have the same exact problem that we do, but vice versa and coming from the other side. So when our customers individually say we need to connect to Mercy Hospital down the street, well, we sell and we build out an interface to that hospital. And that interface will be from our ambulatory EHR to that hospital. And these types of requests are happening all the time and every day. And we have to support and manage and update and secure and audit and review all of these interfaces. And this is something that we do and all of the other vendors also have to do. There is a solution for this, and we've already started well down the path on the solution for this, which is hospital vendors, hospital technology vendors, and ambulatory EHR vendors are actively connecting their entire networks to one another. So at NextGen, we call this NextGen Share. And NextGen Share is our interoperability platform that provides a single point of connection for all of our ambulatory practices. Epic has a similar system they call Care Everywhere, and every vendor has some type of flavor of this. The benefit of using NRLS is that it allows us the opportunity to connect our respective networks for secure data sharing to solve that point-to-point problem we saw on the previous slides. And because it's built on and uses the Carequality framework, it's scalable trust that already provides that point of connection for all of the edge systems and endpoints. And it also has the Surescripts NRLS functionality that Dean described, with those hundreds of millions of records and billions of encounter histories that allow each system to find out where a patient has been treated before and actually go and retrieve that clinical data. So from a NextGen perspective, we can build, and we have built and released that one interface to the NRLS that allows all of our connected customers to support that query and retrieve functionality to discover patients and find out where they've been treated. Our customers are already responding very positively to this functionality. One example is from a customer in St. Louis, Signature Medical Group, that's really excited about the ability to exchange data with their local hospital that's also using NRLS and Carequality. And it gives, according to their CIO, gives their physicians the access to that patient information that they need to make the best care decisions possible. Now, we have a lot of goals for NRLS in the future. We're continuing to roll it out to all NextGen customers, and we're adding automation so that users don't have to trigger the request. It can happen automatically in the background, and also provide the ability to filter the content that gets back, to show only the most relevant information that they didn't know about before. We're also looking forward to actually winding down a lot of those point-to-point interfaces that we have with external systems, because we now have that functionality of Carequality and the NRLS. So I think there's a huge opportunity here from an ambulatory perspective to solve a lot of the problems that we saw on that barriers to connectivity slide from the most recent class interoperability survey. And we're looking forward to using NRLS to solve a lot of those challenges. So Dean, with that, let me hand it back to you and take it from there.
Wonderful. Thank you, Mo. And to give an additional perspective here, a member of the NextGen executive team has expressed their excitement about engaging in this type of exchange, collaborating, cooperating with industry peers to truly expand interoperability to a nationwide level. Surescripts is making available the National Record Locator service free of charge until 2019. Again, being positioned as a service that can help expand connectivity exchange efforts you're engaged in today, has the potential to allow you to consolidate some of those outward connections you might be making today. And we have a link here, go.surescripts.com, get NRLS. Connect to that site, give you some more information about how you can engage in this process, how you could subscribe to this service. Mary, I'll call upon you again. I believe we wanted to try to facilitate some question and answer. If you can help us through that portion of the discussion.
That sounds great. Well, thank you, everyone. Feel free to go ahead and just enter your question in the Q&A box on your screen. We'd love to see some. We do have a couple that we have already, so I'll go ahead and get started. So, Dean, what are the Surescripts plans around the FHIR protocol?
Thank you, Mary. Good question to ask. Today's implementations do call upon the IHE transaction sets. They are using the implementation of those that have been defined per the Carequality protocols, but we are actively pursuing an option that would allow for an implementation using the FHIR protocols for this type of service as well. Anticipate that it will be late this year into the first part of next year where we will have that available. So we do anticipate that there will be some options relative to the messaging protocol that can be used, and FHIR is certainly on our near-term roadmap.
Great, thank you. And Mo, this one will be for you. What sort of feedback have you received from your customers using the NRLS so far?
Yeah, absolutely. So that's a great question. One of the things, the most common thing we've heard so far is that NRLS has reduced the number of requests that they have to deal with manually from hospitals. So hospitals that request medical records from ambulatory physicians, that actually puts a lot of burden on the physician's practice to go pull the chart, retrieve the most relevant notes, and send them back. With NRLS, that entire process can be automated. So having a medical records department manually pull charts, even if it's just from the EHR, they have to find a way to send that data securely back to the hospital. With NRLS, that entire process is automated. So one piece of feedback we've heard is that it's dramatically reduced the number of manual transactions that our clients have had to process by hand. And that's a very welcome change, of course, to those ambulatory practices that are, having to juggle a lot of regulatory and meaningful use requirements on top of just day-to-day patient care. So it's a very, very nice benefit to those practices. And of course, end users love the fact that it's free. So that's, been a very welcome change to those same groups that historically have been burdened by vendors, charging for all types of connectivity and interfacing.
Thank you. Well, so I'll stay on that theme, Mo, for a second. And so was that why NextGen chose to supplement the Share platform with NRLS, or can you expand on sort of your choice, NextGen's choice with that, with NRLS?
Sure, yeah. I think, it's really an extension of things that we're already doing, and it follows a lot of the same themes that we've had with NextGen Share and just general connectivity. It's always been our goal to offer more services, more functionality to enable secure data sharing, really in a scalable way. So when we looked at NRLS and compared it to some of the other national initiatives out there, one of the key differentiators for us and why we chose to go the NRLS route is something that Dean mentioned earlier, which is on day one, our customers already had access to really the largest clinical data set for patient history available anywhere. And that is quite different from other models that are out there. Also, the fact that Surescripts really is in, I think, a unique position to offer this service in a way that no other vendor can really compare to. Having that entire history from e-prescribing and the rest of the Surescripts services allows the network to be dramatically more useful on day one. So supplementing NextGen share functionality, free connectivity to external systems by adding this level of actionable data and the ability to get patient history and location information was just really a natural extension of things that we were already doing. But again, Surescripts is in that unique position, so we jumped on it as soon as we could, and our clients have responded very positively to that.
Well, thank you. All right, Dean, I'm going to throw one to you. So does an EHR customer need to certify with Surescripts to use NRLS?
Well, thank you, Mary. Yeah, there will be a bit of a certification effort. So there is a formal project that we would engage in with a customer. We would assign an integration project manager from our side to help navigate that exercise with the customer. We'd establish the appropriate connectivity to our staging environment, help the vendor conduct some logical testing, assure that they have incorporated ways to both generate messaging into the network, but also when they start to receive information back to their systems, help them work through how they will digest that information. So yes, there is a certification effort. We've tried to design it in such a way that it's as streamlined as it can be. And certainly the Surescripts resources will be available as a consultative resource throughout that effort.
Right, absolutely. All right, well, I think there's a couple more questions around the topic of Carequality. So I'll start with you, Mo. Did you, NextGen, consider using Carequality as a standalone interoperability solution?
Yes, we have, and we are actively using it in addition to NRLS. But what we've done, which I think might be unique, is that we've bundled our NRLS functionality with our Carequality service as it's delivered through NextGen Share. So what I mean by that is NextGen Share is an interoperability platform, but it's also a lot like an app marketplace. So if anyone's familiar with the marketplace that you use for your phone to download apps or download tools for your phone, NextGen Share is almost exactly like that, but for an interoperability perspective. What we've done is we've bundled our Carequality integration with NRLS, because what NRLS provides in addition to Carequality is that ability to locate patient histories. So Carequality is great if you know that your patient was treated at Mercy Clinic or Mercy Hospital, where with Carequality you can just go and request and retrieve information directly from that one hospital. But what's nice about NRLS is that it's going to provide you that insight that not only was your patient seen at Mercy Hospital, but the patient was also seen at these 3 other clinics that you didn't know about because you're relying maybe only on patient memory. So that's really the nice part, is that this is another layer on top of that underlying foundation of the Carequality integration, and we've bundled these two together. And I think it really makes a strong argument that you're giving your providers now all of the tools they need to locate patient information and retrieve it. And one other value of being kind of a Carequality implementer is that our customers can be listed directly in that Carequality directory. So folks can also find our NextGen sites just by looking at that Carequality directory.
Great. And Dean, what value does NRLS add to the Surescripts current and our future Carequality strategy?
Thanks, Mary. So our strategy, our interactions with Carequality are extending capabilities to other members of Carequality. So while Carequality helps set the rules of the road, defines what the technical implementation is, they don't currently serve as a physical, logical network themselves. They've given you the tools, the definitions of how to connect to your trading partners, but you do still have to create a physical connection to do that patient inquiry, to retrieve clinical documents. So Surescripts does a couple things with Record Locator to help ease the burden on vendors. So one is that ability that we've spoken of being able to recognize where has your patient been seen. Once you've recognized an entity that is also a participant or utilizing the Carequality definitions, rather than, as Mo had indicated, even if they are published in that directory that Carequality will publish, it is hundreds of line items, potentially thousands of line items as it becomes more widely adopted. Rather than having a user have to manually sift through that phone book and find the endpoint they want to query for, the Record Locator service, in addition to revealing to you where that patient has been seen, gives you those technical coordinates of where the endpoint resides for the clinical data. And now, using NextGen as the example, the NextGen system recognizes those endpoints as being ones that are listed in the Carequality phone book, and that's where some of that automation can become introduced, and the system can recognize an endpoint, query for content, as opposed to forcing a user to sift through hundreds of line items of a directory, find the endpoint, and manually trigger activity in that way. Additionally, we think that the National Record Locator Service is a good foundation for some future opportunities. There are some intentions to expand the service to include care alerts that could serve as a more proactive way of notifying organizations about things that we learn relative to a patient they've indicated they have an interest in. So rather than individual patient-by-patient requests, there is expected to be a future system capability that would allow you to tell us the patients you care about and have the network send you some level of notification as we learn new information about that patient.
All right, thank you. I think those are all the questions that we have. So with that, I think I'll go ahead and wrap up. I'd like to thank all of you for joining us today. We hope that you've learned a lot and that you take a closer look at our National Record Locator Service to enhance interoperability within your EHR. If you'd like more information, please contact your Surescripts account manager. You can also visit surescripts.com for more information. And as a reminder, an archive of this webcast will be available after we conclude here today. You'll receive an email with viewing instructions in a few days. On behalf of Dean, Mo, and everyone at Surescripts, thank you again for joining us today.